Don't get me wrong, cardio is fantastic. And if you're doing cardio and that's all you're doing, all for it. But cardio is kind of like cashing a check, and then lifting weights is like making the investment. It's investing that money, right?
Patrick Scheel, welcome to the Dr. Tina Show. I am so excited to have this conversation with you today. You are a registered dietitian and nutritionist with NutriSense, and we are going to dive into all things testosterone and blood sugar. So welcome to the show.
Thank you so much for having me. It's a pleasure to be here, and I'm looking forward to it.
Yeah. So can you tell the audience a little bit about yourself? Because I don't know your backstory. How did you get into this line of work?
Yeah, sure. So I am a registered dietitian. Early on in my career, I started as a public health nutritionist, actually, working
Oh,
in a public health setting, more of a community nutrition type deal. And then from that, I moved on to a private hospital, and I worked as a clinical dietitian, seeing patients. And I spent most of my time actually in the ICU. And
wow.
yeah, so the mentality that really drove me into was, wow, more data is better. Simply put, you're in the ICU, you're getting labs done usually hourly, sometimes more than that, because we want to take care of these critically ill patients. We need more data on them, and that actually scales. That carries over when you are trying to do something health wise. If you're trying to lose weight, if you're trying to put on muscle, no matter what your health and wellness goals are, it helps to have more data points. And I really noticed that when I spent a lot of time in the ICU. I would help these pharmacists prescribe tube feedings or parenteral nutrition, through the IV, and then we got feedback much quicker than we would out on the floor. So I loved it. I loved being in the ICU. A lot of dietitians don't clinically, but I liked it. And when I started talking with the people at NutriSense, I started getting really interested in the idea of analyzing continuous glucose monitor data, because it's just more data. We have this data, and I was thinking, what would it be like if I could help people out with this continuous data, with access to this 24/7 glucose curve? And I've come to find out, talking more with a lot of the nutritionists at NutriSense, we were all kind of on the same page. A lot of us came from clinical backgrounds. A lot of us came from backgrounds where we didn't have the best tools to help the people we were trying to help. And I think if you ask any nutritionist that works for NutriSense now, this is just priceless data to have. It really helps us steer the boat. It really helps us help our members to get closer to their wellness goals, like, for sure.
Absolutely. I'm so glad I asked you because that's fascinating. I had no idea. I had no idea you had that background. That's crazy. I mean, that's talk about seeing really extreme sides of things because, ICU, not saying that people get themselves in there, but from all of the doctors and nurses that I've spoken to from all over the world, I have a pretty large social media platform. And so I hear from them a lot. And, I mean, public health is generally, I mean, folks are kind of a train wreck at this point, right? And so you're probably seeing a lot of people on the extreme ends of things. And then over in the NutriSense world, I'm betting more of that. I'm sure it's all walks of life, but a lot of people really trying to optimize and like dial in and see really where they stand with things to kind of get that, what's that edge I can give myself with this data by using this monitor. And I'm just guessing. Does that ring true at all? Like you're seeing you probably were looking at polar opposite ends of things for a while.
Oh, complete opposites. If health is a spectrum, and wellness, whatever you want to call it, in the ICU, I'm catching them when they're sick. They're obviously very sick because we're trying to keep them alive. So that's one end. And then you have, when I started with NutriSense, getting a lot of people who were more biohacker type people who wanted to experiment maybe with a carnivore diet or a ketogenic diet, or kind of were thinking outside the box and wanted to experiment with something else that they read and thought might work for them. And that's what the CGM helps do for you. It empowers you to implement a plan and then get more frequent, consistent feedback, rather than following up, with your doctor or with a dietitian, which is awesome. Don't get me wrong. It's important, just like annual labs are important. But when you get that more granular data, and especially when you have it as a tool to help people, it's a lot better. It's a good way to go.
Yeah, absolutely. And I'll say this about the NutriSense app in particular, because I've used CGMs clinically with patients, and the ones that we use are, you slap, it's the same device. It's the exact same device on the arm, and then you scan it, and the way you're scanning it is really looking at trends in blood sugar. You're not looking at this granular, minute, hour by hour, almost minute by minute that you can get with NutriSense. That's why I like NutriSense, is because I can get really granular and be like, this meal or this stressful event or this lack of sleep or whatever did exactly this, versus kind of like what happened that whole day. I did want to say something, just, I know this is off topic, we don't have to get into it, but something that I really want people to understand that is so critical. So like, let's get our blood sugars under control. And that was my whole platform during or prior to, for years, like metabolic health. And so it's really interesting. It's an interesting phenomena. And you've probably seen this on the clients you work with through NutriSense and probably in the ICU. When your body is under siege, your blood sugar goes crazy. So when you're walking, the way you walk into something, your metabolic health, your blood sugar regulation and metabolic flexibility as you walk into any kind of onslaught, whether it be an upper respiratory virus or anything, is critical in how you're going to get through that. I believe that is sort of the delineating factor. If you walk in with really, really brittle blood sugars into anything, it's kind of a crushing blow to the system. Do you want to speak to that at all?
Oh, sure. I mean, if you look at kind of a spectrum of, maybe fit to unwell, whatever situation you're going into, whether it be an interview or a life-threatening illness, I mean, your body is just going to respond to it better if you were more on the fit side. Patients we had back, in my clinical days in the ICU, a lot of them kind of were in the same situation where it was usually some kind of blood sugar dysregulation. When I would talk to them afterwards, if I was able to, they really didn't get a whole lot of guidance. Usually it was something along the lines of, eat less carbohydrate, eat this, do that, without really any kind of consistent, measurable way to keep track of that, besides assuming they're getting like A1C done and assuming they're going and getting their blood work done. But a lot of people don't. And right. Especially when you think of maybe men are a little more reluctant to do that as well. So oftentimes you would see, blood sugar dysregulation, cardiovascular disease, kidney disease going into these situations when you're now maybe put on life support and you're kind of, there's a quote that I really like: we don't rise to the occasion, we fall to our training. So whatever preparation you put into something, however well you're taking care of something, your body's no different. Just like you would practice maybe for an interview, or you would practice before a game or whatever you're competing in. You wouldn't just show up and expect everything to go exactly how you felt like it's going to because you're in the mood right now and you're motivated. Your body, it doesn't work that way, and your body doesn't work that way. When you show up to things in a more healthy state, you're just going to have a better outcome. And I'd imagine, I can't think of any literature specifically off the top of my head, but I did see that in the ICU for sure. And you could assume that's the case. People that come in with better health, maybe not a history of diabetes, their heart's in good shape, renal labs look good, maybe they're exercising regularly and eating a decent diet, they would have better health outcomes and usually not have to be put on life support like intubation and things like that.
Yep, that's it. That's why I hound people during the late summer, early fall months to really, and even now, even this late into winter, like figure out where you stand and work on it, because even little incremental efforts towards the goal of better metabolic health, it kicks in immediately. I mean, yes, it takes about 90 days to see changes on labs, but it only takes a few weeks to start to see changes on glucose or, CGM, like things, you start to see it pan out, inflammation goes down, et cetera. So, okay, good. I just wanted to drive that home while my dogs are sitting here growling like crazy in the background. Can you hear them?
I can't hear them. No.
They're going at it. So we're going to talk about men and testosterone. Ladies listening, this applies to you too, because testosterone is a hormone we all need. I did a whole podcast episode on it. You guys can listen to it. I'll link it in the show notes. But testosterone, metabolic health, testosterone and blood sugar handling. Let's dive in. Like, give us the high points. I'm going to let you have the floor here, because I have said this ad nauseum, and I think a guy needs to say it so the guys will listen.
Yeah, sure. So when we talk, poor metabolic health, insulin resistance, cardiovascular disease, hypertension, all these things, a lot of times we don't jump right to testosterone, right? Or hormonal balance. We don't think about those things. And especially for young men, you think, whatever, stress, I can handle it. Sure, I know I could probably lose a few pounds, or the doctor's saying my blood sugar is a little bit dysregulated. It's a little bit high, whatever, right? But the thing is, there is a very, very distinct known relationship between metabolic health and testosterone levels, and more specifically, glucose control and testosterone levels. As we see the progression of insulin resistance, we tend to see lower testosterone levels. There's a lot of different mechanisms and things that kind of are interwoven in there that you can talk about, proposed mechanisms, what's actually happening. But we do know, for example, that insulin resistance causes a lower secretion of the Leydig cells in the testicles to secrete testosterone, which is kind of interesting. There's one study that looked at testosterone production from the testicles, and they looked at also luteinizing hormone, which is stimulated from the pituitary gland to stimulate the production of testosterone. And they didn't see any disruption. They saw normal regulation of luteinizing hormone. So the luteinizing hormone was being released. There's something that it actually does in the testicles, apparently, because luteinizing hormone was being released, but the testosterone production was decreased the more that we saw insulin resistance. So there's a direct relationship there. And you see this through a lot of different studies. There's one where I think it was 2020, they looked at over 300 pre-diabetic men that were also symptomatic of low testosterone. And they split them into two groups. And they treated one of them with testosterone injections. This was an 8-year-long observational study. And then they looked at the results after 8 years. They followed up with them. Well, none of the men that were treated progressed to diabetes. And 90% of them were actually below the threshold per A1C of being pre-diabetic. Whereas in the group that was not treated with testosterone, over 40% of them progressed to diabetes. So it's like, there's this clear relationship where it's like, okay, healthy testosterone levels, healthy normal sex hormone, regulation is definitely helping with keeping blood sugars more stable. But also, when we have this insulin resistance, when we have blood sugar dysregulation, that's definitely not doing anything for our sex hormone production as well, right?
I love this. Let's back up a second just so that everybody understands exactly what you just said. So luteinizing hormone, which is happening in the brain, sends the signal to the testicles, just so everyone understands, sends the signal to the testicles to make testosterone. Insulin resistance was not impacting that signal. Something was busted in the testicles. Some process was not working right when it came to testosterone production. Is that correct, what I'm hearing you say?
That's correct, yeah. And I like saying that because what's really interesting is all the other stuff's happening too. We also do see instances where different downstream effects of poor metabolic health will disrupt that signal, right? Like we can lead to poor sleep, higher cortisol levels, all these things, and we will see disruption, right? Obesity in general is you're going to see more inflammation. You're going to see higher aromatase levels. You're going to see higher conversion of testosterone to estrogen, right? That's all on the table too. But we do also see that at a cellular level within the testicles, that there's also something happening, which is interesting, right? So I think my point is that there's all these angles, so much to talk about there, where there's all these different angles where poor metabolic health is directly impacting so many different areas of our wellness and health. And I think testosterone is an important one to talk about, because when we look at things like erectile dysfunction, you also see that testosterone, when it's functioning normally, is going to act on the endothelial cells, in our vascular system. It's going to help produce nitric oxide. Well, if we're having insulin resistance and we're having chronically high blood sugars, not only are we having structural damage to our vascular system that's decreasing this nitric oxide, is causing all these other, increasing our risk for other chronic health conditions. But at the same time, insulin resistance is also decreasing testosterone levels. So you have the structural damage, and you also have the functional and signaling damage too that's happening.
Absolutely. And then let's reiterate what you said about testosterone being beneficial. I've always said to guys as they age, I'm like, if you're not, I firmly believe this. I believe that most women over 40 should be on a little thyroid. And I believe most men over 40 should be considering some kind of level of TRT, even if we're like literally microdosing it. And women too. Honestly, women should consider it, most women. But if your testosterone is low, you might as well have one foot in the grave. That's what I tell men. So whether they're doing it naturally or whether they're doing it with replacement, if your T is low, as you get into middle age, you might as well have one foot in the grave and you will end up with diabetes. So for the folks listening, this is a chicken and egg phenomenon. Like the T is driving good metabolic health, poor metabolic health is driving low T. We see the problem. So where can we have direct impact? We can control some of these variables pretty well through our lifestyle management, right? Through good metabolic health practices. So anyway, I'll let you continue.
Yeah, sure. Just like you were saying, that being said, if we can, when we do these things, when we take control of our metabolic health, when we look closer at, okay, what are we eating? What's going on? What am I actually eating every day? Have I ever tracked exactly what I'm eating every day? We know through nutrition literature that our own self-report and self-recollection of what we're doing and what we're eating is very poor. It's very unreliable. If you're going to try to put everything in your head and kind of count the amount of protein you're eating every day, you can probably eventually get to that point. But if you're trying to track everything and you think you can just do it from recollection, the literature suggests that is very, very difficult to do if you've never practiced it for years and years and years. So what can you do? You can look closer at data. You can use tools that are going to really serve you well. And tracking is probably like the first thing I always suggest is, okay, what exactly is going on here? When was the last time you tracked? With everything that I know, I still will sit down and track everything for at least 2 weeks every like 6 months or so, just to see where I'm at. Because one of the other things to consider too is we go through stages, right? We go through seasons. We get new jobs. We have a breakup. We get in a new relationship. We have a dog. We have this. We have that. Things change in our life. And rarely does one thing ever change in our life. We usually, just as we change things and things change us, it usually impacts multiple areas of our life, right? So that's going to include how you're eating. So that's why I always, once you get in the habit of tracking, I always recommend to make it a habit of at least a few times a year, because we want to see what's going on. And especially if you can track and you can couple that with something like a continuous glucose monitor, it's an awesome combination, because again, you're getting that granular data. You're seeing exactly where are these swings and when are they happening. And not only is important, but we always talk about the 4 pillars of health, which are nutrition, exercise, sleep, and stress. You can see exactly what's going on a granular level in all of those areas of your wellness. And I think it starts though with that first step. With someone who maybe that doesn't sound cool to, that sounds like a lot. Let's start with taking a look and assessing, because we know as practitioners, the first thing we want to do is we want to assess what's going on, right? You just see what's in front of you and look what you actually have to work with. And then you can start pinpointing strategies. And, I got to say, what's awesome about our program and what really sets NutriSense aside is that you have an experienced nutritionist with you for the first 30 days of every subscription for free. So it really, really helps kind of take a tool that could be a little more complicated if you've never used it before, but extremely beneficial. And you have a friend there for the first 30 days to walk you through, okay, this is how this is related to your goals. This is exactly what we should probably focus on, and then take it from there.
It's so helpful. First of all, the app is really easy to track my food. I'm not a big macro tracker because I struggled with eating disorders my whole life. So like getting that granular with my food really, I don't know, it triggers me. But I do want to track my protein intake, and because I'm notoriously terrible about getting enough protein. So I found it to be incredibly easy to use. And there's an AI component that just makes the whole thing so easy. And every time I'm either completely horrified at my protein intake, to be honest, because when I get stressed out, I stop eating, or I'm like, wow, I'm really hitting my macros and I feel really proud of myself. So that's great. Little wins, little dopamine hits. And then the registered dietitian on the other side will usually signal me. I'll get an email or a text. It comes through email, but it comes through the app too. And they're like, hey, your blood sugar did a big swing. What happened? Like, you didn't track anything there. What do you think that was? And I'm like, oh, I worked out, or oh, it was stress, or oh, I ate ice cream, or oh, I drank wine that night, so it's very telling. And like you, I'll do it several times a year, usually 3, if not 4 times a year, because I live in a very seasonal place. I live in Oregon and we have our 4 seasons. And I'm always so interested to see how the season's impacting me, and also how my overall food intake is changing, my stress, my just temperature regulation, all of that, how much activity am I getting? It usually declines in the winter, and all of that, I'm able to really get a bird's eye view into my blood sugar handling with that system. It's really cool. And it's very telling, and it keeps me honest, which it's so easy. You said that studies show that people are notoriously not good at remembering what they ate. But I think it's the same with anything. Like if you look at even obesity studies, people don't even categorize themselves in the obese category or the overweight category. I mean, there's just this subjective version we have of ourselves. We're all guilty. We're all humans. The way our brains work, we will lie to ourselves constantly. And I feel like this is a great way to see what's happening and to not lie to yourself. You know, data doesn't lie. So it's a good one. Let me ask you quickly about, so you mentioned aromatase. Can you, for the audience, explain what that enzyme is? And then can you talk a little bit about sex hormone binding globulin and its relationship to estrogen and testosterone and how that's all playing in? Because I think that's a big factor that people don't understand.
Yeah, sure. So testosterone is so interesting. It's very interesting when you look at the synthesis of like sex hormones and you see them all the way through. And when you start studying it, you realize that this is, you know, you don't, not one thing gets changed. Like when you see something that says, oh, boost testosterone levels, whatever, you're like, what is it doing? I want to know a mechanism. What's happening there? Because, you know, we can get into that later or something, because I did look at some supplements and develop some opinions around them. But yeah, it starts with cholesterol, and testosterone is downstream from cholesterol. It's going to be created as a sex hormone. But, you know, I'll spare going through exactly how testosterone is created. But so when we have testosterone, it can be kind of siphoned into two different areas. It can basically moves into DHT, or it can move into estrogen, right? And so we can get DHT from testosterone via 5-alpha reductase, which is an enzyme, or we can have aromatase, which is an enzyme that is going to convert testosterone to estrogen, right? Those are usually the two fates of testosterone. And we do need, as men, we need estrogen, just like women need testosterone, but we also have a range that our body is going to tightly keep our testosterone and our estrogen, right? If we have all of our testosterone being siphoned off via aromatase into estrogen, that's obviously going to cause some problems. And you see this in later stages of obesity when we have a lot of inflammation going on. When you have higher levels of insulin, you tend to see, especially in an inflamed, insulin-resistant, more obese state, you're going to see higher levels of aromatase as well. And so with higher levels of aromatase, we're seeing more conversion of that testosterone to estrogen, right? And again, that's normal. That's how men actually get most of the estrogen in their body, is it's converted from testosterone. But if it's constantly at a higher rate being converted, now we have lower testosterone levels, then that can be obviously an issue. And then the same thing with DHT. We want it to be, converted over to DHT, because DHT itself is extremely beneficial too for men. When we look at sex hormone binding globulin, this is where it gets pretty interesting too, because with sex hormone binding globulin, a lot of people don't realize is going to basically house 98% of your testosterone. And we're only going to have a very small amount that's what we call free testosterone. And this is kind of a pet peeve of mine when people get blood work done. They say, oh, my testosterone was 800. My testosterone was 900.
Right.
But as you know, it doesn't really matter. And that's kind of interesting to a lot of people when they say, what do you mean? It's like, well, if your testosterone was 900 and then your free testosterone was 7, that's kind of bad, right? We want our free testosterone to be at least 2% or more of our total testosterone. If you go to LabCorp or look at some of the ranges given, they'll tell you like above 1.5% is normal. It can be below 2%, but you probably want to go and find out exactly why it is below 2% if you're hanging out at like 1.5%. But that free testosterone as a percentage of your total is very important. And again, this is due to it kind of just being shuttled around your body, bound to sex hormone binding globulin and also albumin. That 2% available is really important. So what happens if sex hormone binding globulin is going up or down? Well, it turns out we don't really want sex hormone binding globulin to go too high, and we don't want it to go too low.
Yep.
And when it can go high in response to diabetes, depending on the stage of diabetes. Sometimes we see higher levels of sex hormone binding globulin, but it tends to run inversely to insulin. So this is why, so to give you an example, type 1 diabetics tend to have very high sex hormone binding globulin, those individuals with type 1 diabetes, because insulin levels are incredibly low endogenously, obviously, right, through the nature of type 1 diabetes. And then in earlier stages of type 2 diabetes, you might see a much lower sex hormone binding globulin because insulin levels are really, really high. And then as it progresses, you might see, obviously as the nature of insulin resistance progresses, you see lower and lower levels of insulin because beta cells of the pancreas are kind of getting shot out. And then you might see a change there as well. Kind of a lot to unpack there, but sex hormone binding globulin, super important. And that notion of, the relationship between SHBG and insulin, super important to kind of understand. And it's a super important player in the whole game surrounding testosterone and its relationship to glucose for sure.
Yeah. So I'm gonna back up a bit just so that everybody understands clearly what you just said. Aromatase is an enzyme that turns your testosterone into estrogen, and it's higher when you have more fat on your body, particularly visceral fat and belly fat, guys. So I always tell guys, like, if you're rocking a gut, get rid of it. Getting rid of your gut, working all your efforts around getting rid of your gut is one of the best things you can do for your testosterone, so that you're not creating a depot of aromatase enzyme, because then you're just turning everything into estrogen. And men need some estrogen, but when it gets too high, when folks were looking at the data several years ago on, TRT replacement therapy is dangerous and people are having strokes, et cetera. No, the testosterone wasn't the problem. It was the estrogen that it was turning into. And so if your doctor's not keeping an eye on your estrogens when they have you on testosterone replacement therapy, big problem. And then sex hormone binding globulin is basically the protein shuttle of that testosterone. And so you could have great total testosterone. And a lot of doctors will run it if you ask, and they'll even give you testosterone replacement, but they won't look at your free T. And what's free is what the cells have to use for the body to use cellularly. So we want a good, healthy free T level, and somewhat irrelevant of what that total T is to me. When I see a high total T, I'm like, what are the estrogens? What's the free T? What's the sex hormone binding globulin? Because another weird caveat, which you might understand better than I do, your sex hormone binding globulin will go up in response to high insulin, but it will also go up in response to really low carb diets. Like, I see it in carnivore people. Why is sex hormone binding globulin going up? Is it because of because their insulin is so low? Like, I don't quite understand it.
I think that is the generally kind of accepted mechanism there. Yeah, I've heard quite a few people talk about it, and you do see that in some of the literature. It's not in a whole lot of the literature, though. It's interesting to me because a lot of times you'll see studies that look at, higher fat ketogenic style diet increased total testosterone levels, right? In a lot of these studies, you don't see a free T being tested or SHBG or anything like that. But yeah, so to answer your question, yeah, I think that's what's going on. If we are on a lower carb diet for a prolonged period of time, insulin levels are going to drop lower. Insulin is a hormone. And like I said before, you don't just change one hormone. It's like, oh, we're going to lower this hormone. We're going to lower this. We're going to increase this enzyme or whatever. It's going to have a downstream effect. It just doesn't work that way. And so, again, insulin and SHBG, sex hormone binding globulin, are inversely related to one another. So you tend to see lower insulin levels with higher SHBG, and lower SHBG, higher insulin levels is how you tend to see it. So if we're on a lower carb diet, maybe a carnivore style diet, a ketogenic diet for a long period of time, we have insulin levels that are low. And a lot of times that's great. It's awesome. Insulin levels are lower. Awesome. It's great to see. But if we do that over time and our body is now at a kind of normal set point of having very low insulin levels, well, then we might see a sex hormone binding globulin that's been climbing as well. So now we have a higher sex hormone binding globulin, which is binding up more of our testosterone and lowering our free testosterone. And I think that is kind of what's going on there.
Yeah, I agree. I blew out my insulin response. I mean, I just have chronically low blood sugar and chronically low insulin because from decades of super low carb. And so, that makes you actually, it's not great. Like, and then extreme burnout and stress will cause your insulin to plummet in some cases too. So just all that to not confuse the audience, but understand that there's no exact formula here. It really depends on how that person's been eating for a long period of time, how they're moving, what they're eating, what they're doing, how much muscle they have, etc. But not to get all nerdy. We're kind of nerding out here.
It's all good. It's hard not when it's super interesting. The stuff is really, really interesting because it's just, whenever you think of something, you feel the need to explain all these little mechanisms. And sometimes you're like, I don't think you need to. I do it to my wife sometimes.
I know,
I'm
I'm
like,
with
oh, what's
you.
happening is this. And she's just like, you lost me.
I
I
know,
zone.
my husband too. My husband like glazes over and he starts making up like made up names too. So he has his own made up names to kind of fill in the like as a joke. So instead of circadian rhythm, he calls it Targaryen rhythm. And if I'm looking at my phone late at night, he's like, "You're messing up your Targaryen rhythm."
That's funny.
It's so funny. And he's doing it in jest, he's got a whole bunch of medical terms in funny. It's like our own language. It's pretty good. So, okay, cool. This is epic information, and I want guys to understand this. So keep your body fat in a healthy level. We don't want it too low. We don't want it too high, but probably most Americans could err on losing a few pounds. Your fat cells are secreting and sabotaging your testosterone's best efforts. Even if you're making plenty of it, it's kind of getting gummed up in the works of the metabolic dysfunction. So we want to have muscle on our bodies. We want to have low body fat. So it's about body composition, not size, right? We want good muscle mass, low fat there, especially around the midsection, that visceral fat, really important. There's kind of a joke, like if you can't see your penis, you're probably in trouble, but I would dare to say that comes much earlier, because I do want to dive into this a little bit. Men need to understand, at least what I saw clinically and from all of the doctor friends I have that I've asked this question to, erectile dysfunction tends to come later than you would think. So when I would ask men about their testosterone levels, one of the first symptoms I would see is actually lack of hair on the shins bilaterally. I would see low shin hair. And then I would say, hey, because I did musculoskeletal stuff. I did regenerative injection therapy. So I was always, I'm looking at their knees, I'm pulling up their pant leg, checking out their knees, doing a orthopedic exam. And I'd see that they had low hair, or it almost looks like it's balding right there on the front of the shins, on the tibia. And I'd say, hey, how's your testosterone levels? And they would always punt to the erections, and they'd be like, oh, I'm fine down there. And I'm like, okay, well, how's your stamina at the gym? How's your recovery? How's your injury recovery? How's your healing time? Et cetera. They wouldn't have been in my office if they didn't have joint pain, so it's those kinds of things. How's your tolerance bands? How's your temper? Because when your T goes low and your estrogen goes high, that's not a pleasant guy to be around. Those guys are not fun. They're grumpy and they're kind of bitchy, and it's a bad combo. So ladies, if you're watching your husband's demeanor shift and they're starting to get a bit of apathy, but yet they're like quick to, almost like PMS-y, like quick to gripe at you or have a little bit of a temper surge, maybe consider their testosterone levels. All that to say, there's a lot of other symptoms that go into this, but erectile dysfunction is often later on the list. And I've also noticed a lot of men don't seem to notice the strength of their erections is starting to weaken, and it's so slow and insidious that they're not seeing it happen. But if your erections are not great, your cardiovascular system's in trouble. That is 100% a blood flow issue. It is contingent on your testosterone levels, but the same exact changes are happening in your heart and in the rest of your cardiovascular system throughout the body. So can we talk a little bit about cardiovascular health and testosterone levels and how that ties into blood sugar?
Yeah, sure. Like I mentioned before, that vascular damage can be coming from a lot of different areas, right? And insulin resistance for sure is causing that vascular damage. Stress in general is definitely not doing anything good for that vascular integrity. So again, when we look at insulin resistance and vascular health, it goes kind of hand in hand. We know that during the progression of insulin resistance, as blood sugar levels are higher and higher, as insulin levels are higher and higher, advanced glycation end products, you can get into these kind of things too, which are just basically, the way I usually put it is, we don't want a lot of stuff in your blood. This is a lot of stuff to be in the blood at one time. You know what I mean? You start seeing this kind of cascade of basically too many things being in the blood at once. And think of anything that is in a confined area and there's too much of it, and there only should be a certain amount of it, then that's eventually going to compromise the structure and integrity of whatever's holding it. It's kind of the way I think about it and the way that I explain to members. They're like, okay, what's going on here? Are you saying glycation end products and insulin is low and high and blood sugar? I just say, you know what? There's too much stuff in your blood at one time. Think of it that way. And that's going to eventually mess up the lining of these blood vessels. And that's not the only angle that you're disrupting your overall wellness. This is also going to impact your testosterone levels. Again, that's going to in turn impact the nitric oxide production that leads to healthy erections. There's a lot of different angles you can kind of do this, but again, the insulin resistance that is definitely contributing to that vascular damage. The fact that that testosterone levels are lower in the setting of insulin resistance is super important to understand for sure.
So cardiovascular health, insulin does a whole lot of bad things to your vascular system. It hardens things, it makes them stiffer. It keeps you, like you mentioned, you've got a decrease in nitric oxide, so you're not vasodilating the way you need to. Everything just kind of becomes stiff and non-compliant as it should be. And then the advanced glycation end products, I just tell people that their cells are caramelizing. Like the way I think of it mechanistically is like a caramelization. Just not to get too nerdy, but like sugars, most of the cellular receptors are contingent on some kind of sugary something to make it go, like things stick together, bind appropriately. There's always some kind of mechanism in there with glucose, and we don't want those caramelizing. And then the other, just to throw another wrench in it, you'll see ferritin levels go up. Ferritin is the iron storage molecule in your blood, and when the body is inflamed, ferritin levels can increase. And I only say this because this is a very common thing I see in men as they hit middle age, is these ever rising ferritin levels. And they're told to go donate blood to get that iron off because iron rusts. So now you've got like caramelizing, heated up sugars, rusting iron. And to really make it kind of kindergarten version, right? But this is how I explain it to patients. I'm like, you've got excess iron because of the inflammation, and you've got everything in there caramelizing. So you're rusting at an increased rate inside the vessels. This is not good. So you're right. I like that, what you said, like there's just too much stuff in the blood. And I call it thick blood. I'm like, your blood is thick, and this is not ideal. But they'll be told to go donate blood very often. And if they don't have some kind of genetic hemochromatosis, it's more like a functional hemochromatosis. That is not a good place to be as a middle-aged man, especially if you're rocking a belly and your testosterone's low and that the T is turning into estrogen. The issue with getting ferritin back down, in most cases, I saw this a lot, and because I was looking for it in clinic, the best way to handle this is to get your inflammation low, right? And bring your inflammation down. And that can really only be achieved with healthy testosterone levels and good metabolic health. So again, that chicken and egg kind of, it's a vicious cycle that men will get into, and they'll end up in my office in their 50s. And I'm like, oh, this is a hot mess. It's a hot mess of sludgy blood, and taking it all apart and trying to fix it is not as simple as just shooting testosterone. That's what I want guys to take home from this episode, is that testosterone replacement therapy is so important, or just optimizing, like you said, young men. I saw really low T levels in young men very often, more and more and more, as I closed my practice in like 2019. But from the time I got my license and was looking for this, because I was looking at metabolic health long before it was cool, way back when, until the time I left practice, I couldn't believe the amount of young men in their 20s and 30s with just bottomed out T levels, even guys that looked relatively fit, but they were doing things like chronic cardio. They were like runners or cyclists. And then as runners and cyclists aged, I was just telling one of my girlfriends the other day, she's a clinician, but she didn't really know this. I'm like, yeah, every single marathon runner that I've ever treated eventually basically started bordering or dove straight into diabetes in their 50s, and long distance cyclists. So there's that component too, of that highly oxidative exercise where they're not building a lot of muscle, and maybe they're actually in a catabolic state. They think they're doing the right thing because that's how we were taught in the 80s in my age group. It was like cardio, but they're not building muscle. They're not optimizing their testosterone levels. And then and they tend to like to drink, throw alcohol into the mix. Like you said, there's so many factors here. And then these guys would end up with basically pre-diabetic or diabetic labs, and they'd get mad at me. They're like, that's impossible. I run 20 miles a week, or I cycle 100 miles a week. And I'm like, well, you look like a diabetic. And they're rail thin and they don't know what's going on. So can we just touch on that for a second? Because I want the guys to really let this one hit home, that they got to be doing the deadlifts and the squats.
Oh yeah. So I like, who gave this example one time? I want to say it was the Mind Pump guys. I love those guys.
Those guys are great.
I think he gave this example. He said, Don't get me wrong, cardio is fantastic. And if you're doing cardio and that's all you're doing, all for it. But cardio is kind of like cashing a check, and then lifting weights is like making the investment. It's investing that money, right? And this can be interesting to a lot of members that are wearing CGMs that I help at NutriSense, because you see it's more immediate gratification when you do cardio and see your glucose go nice down, slow and steady. Sometimes when you lift weights, you even see an increase, but that's actually expected. And it's kind of interesting. All that actually means is you actually might need a little more carbohydrate in your diet, because all it means is that the energy demand is exceeding the energy availability in your body. But that's a separate conversation. And also when you're working out, when you're actively working out, there's something called non-insulin mediated uptake into the cells with glucose, where you actually don't even need insulin to process that glucose out of the bloodstream into the muscles for energy. So a lot going on when you're working out that's super beneficial. But what I meant by saying lifting weights is more of an investment, what I meant by that was that when you develop your muscle, you have bigger glucose storage tanks. You have more ability to dispose of glucose at any given time. So when you get stronger, you can talk about, getting stronger versus hypertrophy versus this. That's another separate conversation. But when you get stronger, you can assume there's probably going to be a little bit of muscle gained, actual tissue that's gained. So any kind of resistance training is going to be super beneficial for your glucose, even if you don't see it in the immediate future. There's definitely a huge investment you're making, because developed muscle is going to store and metabolize glucose better. It's going to get it out of your bloodstream, put it somewhere that you can use it, so that you can use it again the next time. So I think they complement each other. I think that weightlifting and cardio is great in conjunction. I think a little bit of cardio is going to help you become stronger. It's going to aid in mitochondrial function. It's going to aid in everything that helps you get through workouts for sure. But I do agree, if we're just focusing on cardio or we're doing these long depleting workouts, if your fueling isn't on point, there's definitely going to be some muscle breakdown and some utilization of proteins for energy, because we do have these proteins that are made of amino acids that are glucogenic that can be used to help maintain blood sugar. It is possible. So a lot of different ways you could just be kind of, using all of your tissue for energy, which we don't want. We want strong muscles, and we want to utilize our glucose storage tanks for those longer cardiovascular workouts, but also to help build muscle for sure.
Yes. So do both. I think of cardio as like not zone 2, that's just kind of a given, but I think of cardio as, especially long distance, is sort of, you got to earn it through your strength training. Because if you're, the New York Marathon just happened, and I was watching video footage of it, and I saw so many people who you could tell had gone from out of shape to training and running the marathon. And I was like, oh man, their joints are not happy right now. I mean, it's a lot of pounding, it's a lot of weight. And then if you've got deconditioned joints that don't have good musculature around them, they're hanging on ligaments and tendons and cartilage. And from what you're saying, basically, is, it kind of puts you in that catabolic state. So it's a really important balance. And if you're going to do chronic cardio, as I call it, make sure you're really making that investment in the bank of muscle building, because we got to have something to get through it. It's really important. And if you don't, it's going to send your blood sugar all over the place. And that's how it acts as a chronic stressor, and chronic stressors, that's another subject we should probably close with. Stress, what is it doing to our metabolic health? Because, there's data to show straight up correlation between chronic stress going straight into type 2 diabetes. It's a thing. And I think it's a really underappreciated thing. I don't talk about it enough on my platform, and I should. I've lived it. I've watched myself get mildly cellular insulin resistant. Nothing labs would have shown, nothing a CGM would have shown, but I was starting to get symptomatic, and I knew what it was. And it's stress. So if you want to touch on that for men, because I don't think men really appreciate the stress they're under, or maybe they don't talk about it. I don't know, but maybe coming from a man, they'll hear it.
Yeah, sure. Stress is super interesting. This is that might be the number one surprise that people see when they wear a CGM. What happened here? I ate the same thing I ate yesterday. I did nothing different. I say, well, this is me talking to a member, right? I say, well, kind of paint me the picture. What was going on in the environment? Well, I just sat down for my Zoom meeting, eating the same thing. I said, oh, okay, so you were in a meeting. All right. So any stressful situation, you might not even feel it, which is super interesting, right? And I saw the same thing when I wore a CGM, of looking at my glucose levels when I would give a presentation, or be in a meeting. I'm like, wow, there's a bump there. That is definitely a noticeable bump. That is super interesting. But knowing what I know, it's understandable because, our bodies have this mechanism this fight or flight mechanism when we're stressed out. And I think it's well known, and people know that there's this fight or flight response, right? Your body doesn't know that it's not in physical harm, but it's still on high alert. But there's something interesting happening with glucose levels when that happens. Number one, your body is going to become a little bit temporarily insulin resistant because your body wants a lot of glucose in your bloodstream in case you have to fight, in case you have to go do something. Your body wants that glucose right there, ready to go. You're also going to see more glucose being released from the liver. So you have climbing glucose levels, and you also have your body being in a state where it kind of wants that blood sugar there, ready to use. So this leads to high glucose levels. And it's very apparent with a lot of the people that I work with, for sure.
It's a big deal. And it shocked me. I remember the first time I saw it, I was going to the airport, and I live about an hour and a half away from the airport. So it's always a big adventure through the country in the winter while it's raining. And I had this huge spike, and I got to the airport, scanned my NutriSense, and I was like, wait a minute, I didn't even eat yet. Like, where did that come from? And it was just like anticipatory stress. The spike was before I even started driving. It was actually because I remember looking at the clock as I got to the end of the gravel driveways, and it was prior to that, it was loading the car up. So it's just wild. And if you think about the kind of stress that people are under, men and women, but I think again, men don't really talk about it, right? You're taught to be stoic, and not that you need to have like a long purge of emotions, but just acknowledging that there is stress there. And I was raised kind of like a tomboy, and I was raised to be very stoic too. We don't complain, we don't gripe, we don't share our feelings. And stress, like you just nailed it. Repeat that. When you're chronically under stress, your body's going to keep you in this high glucose state because it thinks you're going to at any second have to run away from the tiger. So you're killing yourself slowly with this chronic elevation. I mean, you're quite literally working your physiology into a pre-diabetic or diabetic state, right? Am I getting that right?
For sure. And especially if things aren't perfect outside of that. Maybe you have, poor sleep. Maybe your diet isn't on point. Maybe you're at the beginning of your wellness journey and you're trying to figure things out. This is usually things that, we figure out down the road, because sometimes there's so many layers of the onion to kind of peel back that we notice that, oh, wow. And also these stressful situations are having a huge impact on my glucose levels too. And yeah, so like you said, this kind of self-perpetuating loop, kind of like the testosterone with the obesity and the inflammation and the insulin resistance. Stress can be coming from a lot of different areas too. And, when we sleep poorly, was it the stress from the day, or was it the fact that we slept poorly last night too? So, well, it's probably a little bit of both, right?
Yep. And it compounds and it stacks, just like our wellness habits stack, our unwellness habits stack. And cortisol is pro-inflammatory. I'm sorry, it's anti-inflammatory, but it is pro-fat hoarding, and it will jack up your insulin and it will tank your testosterone. So chronically rocking the cortisol, maybe you're a lawyer or doctor. Like when I was in clinical practice, I was doing procedures all day long. I was like just burning through procedures all day. And some of those were very high stress, but you get so acclimated to it that you don't even realize it until you're away from it. It's like, until I'm out of the war zone, I don't realize what the war zone was like. And so I think a lot of men are working very stressful jobs. As they get older, it's, things don't work so well because the T's going down. They start to compensate with more sugary snacks, more just carbohydrate. We go to carbs. It makes us feel better. And it's just a vicious cycle that I see with men in my age group. And regardless of even how good they looked, because I was dating all through my 40s, I was dating, and it didn't matter even how physically fit they looked. It really came down to their stress levels and how, like you said, what are the other things they're doing? So this is why we strength train. This is why we try to, get our diet as on point as we can. This is why we prioritize sleep, because we can't always control the stress. We can meditate, we can work on mindfulness, but we can't always control what's going to come at us or what the world's going to bring. But we can, the other factors we have more control over. And so that's where we need to really double down and focus, men and women, as we age, especially, because The world's kind of a shit show. I don't know what it's like. I wake up every morning and I'm like, damage report. What happened today? I don't even want to know anymore. I literally 2 weeks ago, just like stopped following everything and shut down all the apps. Like, I don't want to know. I don't, it's turning into chaos, but
yeah, it is. Sorry, but yeah, just to touch on that, it is interesting because nowadays, I think I saw something that you posted about it. Simple things in our world today can help, with more optimal hormone profile, such as like getting sunlight in your eyes in the morning, not scrolling at night, like all these little things. Our world is set up perfectly to sit around and have hyper palatable foods and not need to move a whole lot and then kind of get stuck scrolling or whatever, stay inside, not really get outside and get the sun in our eyes. And it's just, there's so many things. If you can kind of tweak your environment a little bit, you can definitely move the needle too.
Yes, absolutely. And we do the best we can. I'm not perfect. I don't think any of us are. I know that people want me to be perfect. And sometimes people get really mad at me when they see me being unperfect. And I'm like, I'm just a human being with bad habits too, that I have to break constantly. And it's easy to fall back into them. And it really does help when oh, my dogs are going at it again. It really does help when your partner's on board. This is why we're doing this episode. That was Sansa. She said she's had it. Is he biting you, Sansa? He's such a little viper. I really want the ladies out there constantly messaging me saying, how do I get my husband on board? And I'm like, I don't know, man. I don't know what the answer is, but it helps a lot when your partner's on board because you guys can both really implement these lifestyle habits together. It becomes a family thing, teach your kids, because staying healthy in the current world is an act of rebellion. It's a conscious act of rebellion the way they've got everything set up is really, really, really odds are against us. So that said, a lot of ladies ask me, hey, I want to get my husband on the NutriSense CGM. I know you can't make recommendations, but just what you've seen in your experience working with folks in that atmosphere, what's a good time frame to shoot for? Do people need to do like a 14-day? Is it a 3-month? Like what seems to be, because I can't quite figure out for myself. I think a month, I'm pretty optimized. So a month for me is pretty telling. I usually try to go for 2 rounds of 14-day sensors. What are you finding with folks who've maybe never dabbled with this? What's kind of a good time frame for them?
I think the 3-month at least is a really good one to shoot for. And it's because, like I mentioned before, we tend to go through these, I call them like seasons of eating. We go through these changes. And sometimes I want to see what's going to happen when I give a presentation. I want to know what happens when I'm on a podcast. I want to know what happens when I'm alone and have to take care of the dogs for the whole weekend. I want to know what's going on in these situations. And I want to know what happens when I'm in that situation at the airport where I have to eat like fill in the blank food. I like to know these things. And I think 3 months really kind of gives you those cycles of eating. I think any data is going to be much better than even traditional lab values that you've got. If you do a month of continuous glucose data is great. And from there, it really depends on your goals. Are you someone who's just experiment oriented? You want to run as many experiments as possible? Well, then do the 6-month one because you can run so many experiments. And again, with all these packages, you're going to have a nutritionist at your side for free for the first 30 days. And they're going to be able to really lay everything out for you too and be like, well, according to your goals and your profile, this is what I would recommend that you do with the experiments. Here's how I would lay them out. But going back to your question, yeah, I think 3 months is a good place to start to gather as much data as possible and really see the different situations that you put yourself in and how your glucose responds.
I totally agree with that too, because with patients, it's pretty obvious on lab work, on blood work, that it takes about 90 days. So I would have patients come in and they'd be highly motivated. They do all the dietary changes. It's interesting. It's much harder to get people to do the strength training component, but I usually can get them to do the dietary component pretty quickly. And they would want to rerun labs at 30 days. And I would say, your serum blood is not going to really show much for about 90 days. 90 days. And it also takes about 90 days. It takes about 21 days to change a habit, but it takes 90 days to cement that habit. And so I totally agree with you. If someone's on that journey, especially if they're working with a functional medicine practitioner and they're really trying to do all the things, this is a really great adjunctive tool to add in. It'll give your practitioner a lot of data to go with as well to make sure that they're on the right path. But I wasn't practicing practicing when these were popular. I had already stopped, like I said, in 2019. I absolutely 100% would slap one of these on every single patient if I was seeing patients today, and I would track them for 3 months. I totally agree, because I would correlate that with labs as well as body composition and how things are changing for them. I mean, I think it's just a really great adjunctive tool. It is, I've said this before, and for those just hearing me say it for the first time, I have an Aura ring. I have literally, between my regenerative medicine practice where I had hyperbaric oxygen, which I still have. I mean, I literally have every biohacking tool under the sun in my house. It's like a spa in here. I've got sauna, I've got red light, I've got everything. I've had the Whoop, I've had the Fitbit, I've had everything. That NutriSense CGM and that particular app has been easily my favorite tool and the most telling. Like, it gives me the best information in the shortest amount of time. And if I'm starting to feel like I'm derailing for whatever reason, I'll slap one of those on and go for it again for another 2 weeks just to see, because it snaps me right out of it. It gets me right back into focusing on me and focusing on what I need to be doing for my optimal health. And, that's the most important part, I think, at the end of the day. So anything we didn't touch on, Patrick? Is there anything really important that you want the men to know?
There was one thing that popped into my head that you mentioned before, and you talked about when we were talking about how being on one end of the spectrum, as far as maybe this insulin resistant, more poor metabolic health state, and then also being on the other end where maybe we're just trying to really crush that last few percentages of body fat, right? We're real lean, we're maybe following a lower carbohydrate diet. One thing I wanted to touch on with that is that, what got you out of that maybe overweight, insulin resistant state might not be the thing that's going to carry you all the way through your wellness journey. If you're in that state where you're just, okay, I'm going to do a prolonged fast, I'm going to do this, I'm going to do something extreme. Okay, that's great. But always be thinking the sustainable path. What is the path that I want to do that I think that I could do over and over again? If I'm thinking of a way to do deadlifts, if I'm thinking of this, if I'm thinking of that, don't do it if it just sucks every single time. I mean, there's some nuance to that. Now, if it sucks a little bit, you got to do it. You got to figure out a way to do things that suck a little bit. But my point is the sustainability of it. And I always talk about this with weight training too. I say, well, what is something that you wouldn't mind doing every day? That you wouldn't mind doing a few days a week? What is it that you see yourself doing consistently? Because we know the consistency over a year is so much more important than the intensity of one weightlifting session, or 5 weightlifting sessions or a month of weightlifting. It's so much more important. So if you're in the beginning of your wellness journey, when you're thinking of strategies, in the very beginning, start thinking the sustainability. Start thinking, how sustainable is this? Do I see myself doing this in a year? Do I see myself doing some kind of variation of this in the future? And the answer hopefully will be yes. And you have a sustainable plan in mind.
Yes, I love that so much. I'll add to it because I heard somebody, maybe it was the Mind Pump guys again. If you can't keep a promise to yourself, then who can you keep a promise to? So keeping those small incremental promises consistently that's it. I love that. I love that you said that. I appreciate you adding that in. Okay. Well, Patrick, where can folks find you? I know we want to send them to NutriSense to check out the subscriptions. Is there anything else you want to add that you want them to check out? Maybe the website?
Yeah, nutrisense.io. If you want to sign up, you can go there and just hit get started, and it'll walk you through how to sign up for the subscription. You can check out our Instagram. We're at NutriSense on Instagram. We have a lot of cool reels and information that we post. I'm on Instagram, Patrick Scheel, RDN, Eat, Lift, Perform. That's my Instagram. That's my YouTube. That's my Facebook. Just me posting some nutrition and wellness stuff along with trying to learn skateboarding tricks into my 40s. So
I love it. That's great. I
Yeah.
got to check it out. I haven't seen your Instagram. That's great.
Okay,
I
cool.
will definitely. Yeah. And you guys, listeners of the Dr. Tina Show, can save $30 off any subscription with NutriSense if you guys use the link in the show notes. So be sure to use that specific link and it'll get you to your optimal savings. This has been so great. Thank you so much for coming on the show and sharing your knowledge with us. I hope the men got a lot out of it. And any last tips as a guy going into your 40s you want to send them home with?
Be consistent. Consistency above all else. Find the consistent path and stick to it.
I love it. Okay, cool. Well, thanks so much for coming on the show.
Thank you, Tina. I appreciate it.